Hello and welcome to GP Podcast by Nadia. Tonight is Saturday night and I am still in Brisbane, and today we attended another celebration of Baha'i celebration of birth of Baba and Baha'u'llah, and as I promised that I would not leave you guys alone. Okay, so as I have said this before, that this podcast, which is called as GP Podcast by Nadia, is basically aimed to empower patients. As I just said very clearly yesterday as well, that this is not for sharing my knowledge towards educating GPs, but it is for empowering patients so as we are able to take our healthcare responsibility in our own hands. We own it. We know what to do. We know what we want from our healthcare providers, and we can direct them, or we can actually collaborate with them for the best outcomes. Today, the topic that I really want to touch upon very briefly is about this anti-pharma therapy or anti-medication, not anti-pharma therapy actually, anti-pharma campaign or anti-medication campaign that has been going on for a while now, and it's trying to get in, people are trying to get it instilled in people's minds. Anti-pharma campaign basically entails that people don't need medications, and lifestyle interventions and other non-pharmaceutical or non-pharmacological or non-medicinal interventions should be applied. Like, for example, making lifestyle interventions, dietary interventions for treating different diseases, or exercise, or for example, if it's mental health related, then talking to counselors, talking to psychologists, increasing social activities, abandoning drugs for sure, and doing CBTs, cognitive behavioral therapies, or all sorts of non-pharmaceutical measures. I have nothing against it. Of course, lifestyle intervention is the utmost important thing and is actually the first line of therapy for any kind of disease. If you don't modify your lifestyle, if you don't include physical activity, if you don't include social interactions, if you don't speak to other people, to counselors, to psychologists, of course, nothing is going to help you. But why not be in a gray zone? Why we have to be either black or white? That either non-pharmaceutical or pharmaceutical. No, that's not necessary. We can combine both of them. We can be on medications for, let's say, reducing our weight, for our depression and anxiety, for all the other conditions, whether physical or mental or both. We can be on medications at the same time, as well as consecutively, simultaneously. We can do all sorts of non-pharmaceutical therapies, modifying our lifestyle, incorporating exercise in our lifestyle, being nice to people, thinking positively, going on the spiritual pathways, even trying alternative medications. Everything is good. Everything is good, but we can't choose one above the other. Because if you are coming to a doctor, generally it means that you need help. And yes, doctor is the one who should be telling you about all the lifestyle modification purposes, all the other pathways that you can, alternative medicine, spiritual medicine even, everything that you can adapt to. But at the same time, if a doctor thinks that, yes, it is the time that you should be taking medication as well with it, then please believe your clinician. And I was just reading on LinkedIn, I was going through a profile of a very competent GP, Dr. Daniel Gordon. And one of the lines really struck me because he said, stop embarrassing people for what clinicians have prescribed them. So please do not be embarrassed. Do not get embarrassed by people. Try the medications, try the pharmacological measures if your clinician thinks that you should be doing it. Along with it, definitely, 1000% do the lifestyle modification as well. There will be a time when you will go off the medications, when you will have that strong willpower, and then when both the strategies have worked together, then you will go off them, and or there would be a time when you might lower the doses and still remain on them, depending on how the situation is. Because again, not everybody has same strong genes. Not everybody has all those facilities in life to have the appropriate lifestyle modifications. Not everybody has a strong willpower. So why should we deprive ourselves just because we don't want to get embarrassed? That was the message for tonight, and I'll see you guys tomorrow again.